COVID-19 symptoms like shortness of breath, extreme fatigue, distorted taste and smell, memory loss even, haven't been going away after just 14 days. People experiencing the lasting effects of COVID after more than 30 days of infection are being referred to as COVID long haulers. Many, including doctors, are still searching for treatment to these persistent symptoms. And joining us to discuss long-haul COVID and its lasting effects is Dr. Joshua Kahan, cognitive neurologist at Northwestern Medicine's Neuro-COVID-19 Clinic. Dr. Kahan, thanks for being here. So what are the most common long-term symptoms that you are seeing in patients?
Yeah, definitely fatigue is very common amongst our clinical population, also headaches, and what I specialize in, which is problems with memory and thinking.
And tell us about the work that you're doing on this at the Neuro-COVID-19 Clinic.
Yeah, so what happens is that we see anybody with neurologic symptoms after their coronavirus infection that has persisted. And when they come to our clinic, they do some initial cognitive screening, and based on their results of that, they might end up seeing me for more thorough, intensive cognitive testing. And based on what their symptoms are, what other things may be contributing, we'll come up with an individualized treatment plan for them.
All right, and earlier this afternoon we spoke with a COVID long hauler. She had COVID more than a year ago, and yet it continues to impact her day-to-day life. Take a listen.
Throughout the day will remind me to stop and take a break, to refill my water bottles, stop and take a break to use the restroom, because sometimes the signal from my autonomic nervous system just doesn't send that signal to my bladder anymore. And so I would just go all day and not realize that I hadn't gone to the bathroom. To stop and take my medication, to remember to start dinner. It feels very difficult to lose some of that independence and have to depend on others.
So she's seeing some of those cognitive effects, Dr. Kahan, that you were mentioning. How do doctors treat those specific types of after effects?
Yeah, this is really, really challenging, in part because we didn't have great treatments for cognitive disorders even before this. And we're not exactly sure why some people have these symptoms for a long time afterwards and why some don't. So what we try to do, we try to identify other potential contributors such as chronic pain or sleep problems or anxiety or depression that may contribute to some of these difficulties. But we've also partnered with the Shirley Ryan Ability Lab to get these patients to a cognitive rehab and having therapists tailor a program to their specific needs to try and compensate for some of their difficulties, but also exercise certain parts of their brain that may be weaker.
All right, we also spoke with another COVID long hauler, and this person was experiencing some of the symptoms of taste and smell loss. Let's take a listen.
Now, at the same time that I was noticing things starting to regain a sense of taste or smell, I had to cut out things because all of a sudden eggs tasted like garbage. Chipotle tasted like garbage. Those strawberries from before, like now they actually taste like garbage. I can't eat them. Like all my produce in my fridge, even if I had just bought it the day before, started tasting rotten. I don't think enough young people are as scared of COVID as they need to be. Like it's not just about dying or like your kidneys failing at the age of 22. It's also about the fact that your entire daily reality could shift and you may never get your taste and smell back.
And we should mention she had COVID over a year ago as well. Dr. Kahan, how persistent are these taste and smell symptoms?
Well, unfortunately, they can be persistent for up to and sometimes over a year. A lot of people do get better, but what prevents somebody from getting better with time and what helps somebody with their recovery, we really don't know, and it can be very, very, very scary.
And is there any data showing you whether this is impacting certain age groups, certain demographics, with respect to any of these side effects?
Yeah, that's really a great question, and the data that's published in the literature would suggest that people who have more severe COVID-19 symptoms are more likely to have long-lasting cognitive symptoms or brain fog. and other long hauler symptoms, but there is a significant population of people who are younger without severe illness, and in fact, what many would refer to as mild illness that come to our clinic and complain of these symptoms. And I have to say that that happens to be the majority of people that I see in my clinic are people who have had mild coronavirus, but are now complaining of significant symptoms for many months and sometimes over a year.
And I want to go back to the taste and smell loss symptoms. Is there any treatment for that to get your taste or your smell back?
Yeah, unfortunately, there really aren't great treatments or therapies for this, and it's one of the most troubling aspects of this long-haul COVID syndrome.
And do doctors have any answers in terms of whether these kinds of symptoms could become chronic, or whether after a year or so that they could start to dissipate?
Yeah, I think it certainly seems like some of these things may be chronic, but time will tell, and we're still in the data gathering phase and still learning more and more about this virus and these long hauler symptoms as the weeks and months go on.
Still very early in the Omicron variant, now making something like 73% of the new cases in the U.S. Is there any study in terms of what these new variants could mean for long-haul symptoms?
Yeah, again, because we're just in such a constantly evolving information environment, it's hard to come at hard numbers. I would suspect, given how infectious it is, that there will be more people complaining of loss of taste and smell, but we'll have to see.
All right, certainly a lot more research to do on this very new problem of COVID long-haul symptoms. And our thanks to Joshua Cahan for joining us. Thank you so much.
Thanks for having me.